The Wait is Over. Exploring Surgical Weight Loss on ABC 27 is brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. Here in the call center is bariatric surgeon Dr. Randy Halleck to answer more viewer questions. This is the next viewer question. I thought about having weight loss surgery for years. However, I love the eating experience. I'm hungry from the time I wake up until I go to bed. Sometimes I even dream of food. Is surgery a realistic option for me?
Well, certainly surgery is a realistic option, and certainly food cravings and hunger are a problem for many people. This operation is a tool to help with weight loss. It does require behavioral changes as well, but we have a multidisciplinary team of psychologists, nutritionists to help patients through those issues.
Okay, this is the next question. My family doctor says I should look into weight loss surgery. However, I'm a mother of 4 and the main cook for the family. I'm afraid I'll be too tempted to eat while I'm cooking. Will I ever be able to eat the same food I cook for my family, or will I need a special diet?
Patients that have weight loss surgery, initially there is a special diet, but over the course of months to years, we encourage people to eat basically a normal diet, but a healthy diet. So patients can eat what everybody else is eating, although we hope in reasonable portions and making healthy food choices.
Okay, thank you, Dr. Randy Halleck, for joining us and all of the specialists here. Back to you, Chuck.
All right, thank you, Deborah, and thanks for hanging in there. And joining us now is psychologist Andrea Rigby from Penn State Hershey Surgical Weight Loss. And Dr. Rigby, why is this psychological evaluation? Why is this so important? I'm surprised that it's as tough as it is, and yet it makes sense.
It does make sense, and one of the reasons is because for patients, this is a lifetime journey, and I tell them this all the time. So we want them to deal with the emotional changes with the surgery as well as the physical changes. So when they come and talk to me, we're talking about the mental aspects of the surgery, we're talking about their commitment to surgery, we're talking about their expectations, family involvement, which is very important, and also just how we can support them to be more successful after surgery.
Well, Doctor, what are some of the changes that a patient can expect after this kind of surgery?
Well, they're all quite positive. Definitely they're going to be seeing changes in their body image, self-esteem, lessening of depression, overall awareness of their eating habits, which is a terrific thing as they're going forward and trying to maintain their weight loss, and just a general increase in their activity and their going out into the community at large.
Let's talk about some of the challenges. What are some of the toughest challenges they might face after these surgeries?
That's a really good question, and I think one of the biggest challenges that patients face is dealing with their new body image. I tell them quite a bit of the time that their mind doesn't necessarily catch up with their new physical body. So that's a challenge, as well as getting family members on board. If everybody else is eating macaroni and cheese and our patients are now really making a commitment to smaller portions, exercise, again, making a lot of healthy lifestyle changes and not having the family on board, that could be something that they have to address.
A lot to consider, and thank you for joining us here tonight,
you.
Doctor. And we also want to thank you, our viewers, for sharing your stories and sending in your many, many questions. And if you were not able to get through on the phones tonight, you can still submit your question at our website, abc27.com. Weight loss, and then we'll forward your question to the doctor at the Med Center. If you would like more information or would like to schedule an appointment, you can call 1-800-243-1455. Thanks for watching tonight, and we wish you all good health.